Contrast agent: an oral or IV administration of a contrast agent used to create a temporary artificial density difference. Contrast agent fill the structure with a material that has different density than that of the structure. Positive agents: barium sulfate and iodine has higher density than the structure and they are positive agents. Negative agents: water is a low density contrast and is a negative contrast agent. Contrast agents fill the structure with a higher density fluid so that their margins can be visualized on the CT image. House field units quantify the degree that a structure attenuates an X-ray. In CT, we are able to quantify the beam attenuation capability of a given object. Measurements are expressed in Housefield unit, named after Godfrey Housefield, one of the pioneers in the development of CT. These units are also referred to as CT numbers or density values. Distilled water 0, dense bone 1000, air minus 1000. Negative number: objects with a beam attenuation less than water have associated negative number. Positive Housefield value: substances with an attenuation greater than water have a proportionally positive Housefield value. Housefield unit of naturally occurring anatomic structures fall within the range of 1000 to minus 1000. Housefield unit value directly proportional to linear attenuation coefficient. One Housefield unit is equal to 0.1% difference between the linear attenuation coefficient of tissue as compared with linear attenuation coefficient of water. Housefield unit system: measurements of an unknown structure that appears on an image is taken and compared with measurements of known structure, then approximate the composition of unknown structure. Example: slice of abdomen shows circular low attenuation dark areas on the left kidney. By taking a density reading of this area, it is discovered to measure 4 Housefield unit. Assume that it is fluid filled like cyst. Reading for the cyst is not exact. Suspected that the mass is fluid because its measurement is close to pure water. The difference of 4 units could be caused by impurities in the cyst. Cyst does not consist of pure water. Factors contribute inaccurate Housefield measurement. Poor equipment calibration, image artifacts, volume averaging, polychromatic X-ray beam, polychromatic X-ray beams, X-ray beam sources for CT and CR produce X-ray energy that is polychromatic. Polychromatic X-ray beam comprises photons with varying energies. Low energy X-ray photons, more readily attenuated by the patient. Detectors cannot differentiate and adjust for differences in attenuation that are caused by low energy X-ray photons. To the detectors, any X-ray photon that reaches the detector is treated identically whether it is high or low energy. This phenomena can produce artifacts. Artifacts: objects seen on the image but not present in the object scanned. Artifacts degrade the image quality. Beam hardening artifact: artifact that result from preferential absorption of low energy photons which leaves higher intensity photons to strike the detector array are called beam hardening artifact. Most obvious when the X-ray beam first penetrate a dense structure, that is base of skull, appear as dark streak vague areas of decreased density, sometimes called cupping artifact. Streak artifact arising from the dense petrous bone are as a result of beam hardening. Filtration: filtering the X-ray beam with a substance such as Teflon or aluminum helps to reduce the range of X-ray energies that reach the patient by eliminating the photons with weaker energies. It makes the X-ray beam more homogeneous, creating a beam intensity that is more uniform. Improve the CT image by reducing artifact. Filtering the soft, low energy photons reduce the radiation dose to the patient. Volume averaging, partial volume effect. The process in CT by which different tissue attenuation values are averaged to produce one less accurate pixel reading is called volume averaging. All the CT examinations are performed by obtaining data for a series of slices through a designated area of interest. The nature of anatomy and the pathology suspected determines how the examination is performed. Scanners allows the technologist to select slice thickness and these scanners vary in the thickness choices available. Smaller the object being scanned, the thinner the CT slice required. Thicker CT slices the changes increase the chances of missing very small objects. Example, if 10 slices are created and the area of pathologic tissue measures just 2 normal tissue represents 8 and is averaged with the pathologic tissue, then it makes pathologic tissue less apparent on the image. If an area scan produces images that are suspicious for a mass but no definite, then creating thinner slices of the same area may be useful. While some scanning protocols use thicker cuts, modern scanners acquire data very quickly and have the capability of creating slices thinner than 1 Thinner slices result in higher radiation dose to the patient. If the area to be scanned is large, a huge number of slices are produced. Small structures. If the structures being investigated are very small coronary arteries and the region to be scanned is not extensive, heart versus abdomen, then slice thickness can be quite thin. Longer anatomic region, scan protocols that scan a longer anatomic region, abdomen, pelvis use a slice thickness of 5 to 7 Spiral scanning technique, it allowed options for using data sets to retrospectively adjust the slice thickness when circumstances dictate. Slice thickness z-axis. It has significant effect on the degree of volume averaging that is present on the image. X and Y dimensions of pixels affect the likelihood of volume averaging. Large X and Y dimensions, large pixel, more chance that the pixel will contain tissues of different densities because the house field unit of a single pixel is the average of all data measurement within that pixel. This type of averaging can lead to inaccuracies in the image. Example, pixel that contain equal parts of calcium bone measuring 600 house field unit and lung tissue measuring minus 600 house field unit. The resulting density of the specific pixel is the average of the two tissues or 0 house field unit. The image pixel does not accurately reflect either the calcium or lung tissue. Small pixel size. Using small pixel size reduce the likelihood of volume averaging by limiting the amount of data to be averaged. Pixel size determined by the matrix size and the field of view selected for display. Raw data. All of the thousands of bits of data acquired by the system with each scan are called raw data. The terms scan data and raw data are used interchangeably to refer to computer data waiting to be processed to create an image. Raw data have not yet been sectioned to create pixel, hence house field unit values have not yet been assigned. Image reconstruction. The process of using the raw data to create an image. Once raw data have been processed so that each pixel is assigned a house field unit value, an image can be created. The data included in the image are now referred to as image data. Prospective reconstruction. The reconstruction that is automatically produced during scanning. Retrospective reconstruction. The same raw data may be used later to generate New image. Scan mode. Step and shoot scanning 1980s. Method 1. The X-ray tube rotated 360 degrees around the patient to acquire data for a single slice. Method 2. The motion of the X-ray tube was halted, interrupted while the patient was advanced on the CT table to the location appropriate to collect data for the next slice. Method 3. Step 1 and step 2 were repeated until the desired area was covered. The step and shoot method was necessary because the rotation of X-ray tube entwined the system cables, limiting rotations to 360 degree. Gantry motion had to be stopped before the next slice could be taken, this time with the X-ray tube moving in the opposite direction so that the cables would unwind. Although the terms are imprecise, this method is commonly referred to as axial scanning, conventional scanning, or serial scanning. Helical spiral scanning. 1990s. Continuous acquisition scanning mode eliminated the cables, enable continuous rotation of gantry, uninterrupted data acquisition that traces a helical path around the patient.